In our role as the primary care provider for this patient, we have written refill prescriptions. One issue is that we hope to get approval for a 90-day supply of the meds if his symptoms remain stable. He's unable to drive, and it may be difficult to get transportation to the pharmacy. He does use Sooner Ride for medical appointments and perhaps has family members to assist, but we'd want to provide enough medication to avoid non-adherence related to running out of medication. We will cover the specific learning needs related to each drug later in our presentation. Warfarin is one of the drugs he is taking that may be quite problematic with respect to monitoring for safety and potential drug interactions. With a person who's been diagnosed with mild mental retardation, we will need to be very clear with instructions on how to take medications safely. It would be especially important to provide clear, simple methods or enlist family members to help in this process. As part of the teaching plan, we will need to address issues about the schedule of taking meds. Levothyroxine is one of the drugs he will be taking that will need to be taken on an empty stomach, so this will be part of our instructions. Often in taking care of patients in a specialty area or even in primary care, we are often not adequately prepared to address issues related to behavior and mood. It'll be important to work closely with a psychiatrist if needed to ensure these needs are addressed. Okay, let's quickly review the reason this patient is taking each drug. Based on his history and current presentation of symptoms, each drug that is prescribed seems very reasonable related to addressing the pathophysiologic underpinnings that have resulted in his current symptoms. Amiodarone will work to help his heart regain and maintain a normal rhythm. It is normally only indicated for serious, life-threatening arrhythmias. It carries with it a high risk for potential toxicity related to its narrow therapeutic range. Diltiazem is prescribed to address the tachycardia that is part of the clinical picture. It'll work to lower blood pressure through arterial dilation. It is also indicated for the treatment of cardiac dysrhythmias, which fits the picture of this patient. Levothyroxine is the replacement hormone for individuals with hypothyroidism. We don't know the history of this condition, but this drug is, of course, the gold standard in treatment of inadequate endogenous thyroid hormone. We do know that amiodarone is an iodine-containing compound with some structural similarity to thyroxine. The drug's high iodine content likely is a factor in its effect on the thyroid gland. Warfarin is part of the recommended treatment for AFib. It addresses the potential for abnormal clotting. In the patient teaching, we'll need to address the need for understanding the role of vitamin K in the diet, as warfarin is a vitamin K antagonist. The lisinopril, being an ACE inhibitor, works to decrease the action of angiotensin II and its role in vasoconstriction, which of course leads to hypertension. As noted earlier, we are not clear about the indication of the atypical antipsychotic, but we speculate it has something to do with behavioral issues.